Chair, I move to strike last word.
The gentleman is recognized for 5 minutes.
Madam Chair, continuing this discussion on this massive reconciliation bill that the one that I'm talking about is the one that we didn't have enough time to debate in this committee. But then again, we're on what, the third iteration of it? So what difference does it make? It's not anything like it was before when it came before this committee. And it's so big, none of us have had a chance. And I don't know if anyone on Capitol Hill has had a chance to read the whole bill. It's so big. And therein lies the problem. There's language in this bill that would have severe consequences for disproportionate share hospitals. That's what we've been talking about. And you know, you say it's the hospitals. It's not the hospitals. It's the patients. You know, that's the problem in Washington, D.C. When we talk about health care, we talk about money, when we should be talking about patients. Do you realize what this is going to do? Do you think it's going to penalize the state? Do you think these 12 states that are going to suffer because of this are really going to suffer? It's the patients who are going to suffer. We've always understood, Congress has always understood the importance of Medicaid dish payments. And we've repeatedly delayed cuts to these payments. Time and time again, Congress has delayed cuts to these payments. Medicaid dish payments are intended to make up for Medicaid underpayment and uncompensated care, as hospitals generally receive about 60 cents from Medicaid compared to every dollar received from private insurance. That's what DISH was for. But Democrats are proposing a 12.5% cut to DISH allotments in the Build Back Better plan. And this cut remains in the third iteration, in the last text that was released by the Rules Committee just yesterday. I implore my colleagues across the aisle to ask themselves, why would you want to cut DISH payments to hospitals who largely serve low-income populations by 12.5% in the middle of a pandemic? Don't we realize what's going on here? Folks, I represent South Georgia, a rural area. We're suffering. We've got rural hospitals who are closing. They need help. They especially need help during this pandemic. And yet you're so set on forcing one-size-fits-all approach to Medicaid expansion on states that you'd rather put hospitals out of business, impacting the patients, and risk a patient's ability to get care. As I say, I represent a state that didn't expand Medicaid. We didn't expand Medicaid all the way to 138%, but we did receive a waiver that got us up to 100% of the federal poverty line. And there's no coverage gap in our state. There is no coverage gap in the state of Georgia at all. Yet from 0% of the federal poverty line to 100% in the state of Georgia, you get Medicaid. And from 100% up, you get Obamacare coverage. We don't have a gap. But you want to penalize us because we didn't do it the way you wanted us to do it. Because we didn't follow the cookie cutter example out of Washington, D.C. We did what we felt was best for the state of Georgia. That's what we did. Now you're choosing to penalize our state. And again, it's not the hospitals you're going to be penalizing, it's the patients. Because you're going to put the hospitals out of business, and therefore the patients are the ones who are going to suffer. These proposed cuts would be as much as $7.8 billion in federal funding over 10 years. These payments keep hospitals going. They enable hospitals to care for patients in Georgia and in every other state. This Build Back Broke plan should not move forward, and these cuts should not happen. These are real cuts affecting real people. Keep that in mind. I want to yield the few remaining seconds I've got to Representative Crenshaw.